Hello. No problem. Okay, so just to tell you a little bit about myself, I work as a GP. I've been working in various different sort of settings. I work as a general practitioner in hospitals, also in GP surgeries. I also have recently become involved in some private general practice. Um, in addition to this, I've got interests in medical leadership. And can you hear me okay? Can you just write down something if you can hear me okay? Ivan, if you can hear me, if you just can you just write down that you can hear me? That's great. Can you hear me there okay? Yeah, so I qualified as a doctor. I qualified as a doctor about 10 years ago, or 11 years ago now. Um, and I trained initially as a junior doctor, then went into specialty training to become a GP. I've been working as a GP now for over 5 years. I guess I went into medicine in the same way that lots of other bright-eyed sort of 16-year-olds with thoughts for trying to help people go into this sort of field at the time. I wanted to combine my passion for sciences with with dealing with people, which I felt that medicine combined the two very well. And since that, I found that medicine is something that's so vast that whatever your interests are, if you're more academic, if you're more artistic, there's something in there for everybody. So to become a doctor, it took about, it took 6 years of training. There's 5 years of medical school. I also did a BSc for 1 year. And then you qualify as a junior doctor, essentially. But then from that, you do foundation training, so that takes another 2 years, and then from there you go into your chosen field. So I went into general practice, and that took an additional 3 years of training. So overall, after to become a GP, it takes about 10 years. If you want to become a specialist in another field, it may take sort of up to 5 to 8 years after your basic training as well. So it's quite a long journey, but worth it for those people who really have a passion for their chosen field. So I worked in the NHS for about 5 years. My initial experience was working as a junior doctor, and through various hospital rotations. So looking after people on hospital wards, doing different specialties. Then also working as a GP trainee in GP surgeries in different parts of the country. So yeah, and then from there, I mean, my day-to-day work still involves working with NHS patients all the time. And I specialised in general practice. So GP in itself is a specialty. Some people kind of regard general practice as just a GP, but we're actually, you have to do specific training to become a GP. It's, you need to know a little bit about everything. We manage the vast majority of conditions that people come to see a doctor about, and when somebody does need to see a specialist, that's when we refer to other specialists. In other parts of the world, people kind of self-refer to specialists directly, and that actually isn't a very efficient way of running a healthcare system. And in the UK, we're actually praised in having a very good model in which primary care is the key, and it's the sort of the basis of the NHS essentially. So in addition to the questions about someone suffering from cancer, what happens to the body to go from one stage to another? Well, cancer, it's a horrible illness, of course. There's lots of different reasons why people can develop cancer. They can range from genetic reasons. So some people, unfortunately, are born more susceptible to developing certain kinds of cancers. And there may be environmental triggers that happen. For example, somebody may be exposed to an infection that may lead to that cancer becoming active in their body. Some people develop cancer through lifestyle choices. So, people who drink heavily or smoke heavily will increase their risk of certain cancers. So essentially it weakens your body's state to a point where cells begin to multiply uncontrollably, and then they lead to all sorts of different dangerous cancers. So just to answer the question regarding Dr. Sebi's passing, in terms of holistic practices, alternative medicine, complementary medicine, holistic medicine. As a medical doctor, we always try and work through evidence-based medicine, where we use facts, where we use statistics and trials and the rest of it to try and develop new treatments for certain conditions. However, there's an increasing body of evidence out there that says that holistic medicine can work quite well for people, and lots of people believe in it. And if people believe in something and they feel that it works for them, then there's no harm in using it as an adjunct to help to manage their illnesses. I don't think it should be used as a replacement for evidence-based medicine. But this is down to personal choice. I mean, the famous example is that of Steve Jobs, who sadly died of pancreatic cancer. He was an avid fruitarian. He only believed in eating fruits as a diet. He believed that you could fight his cancer through lifestyle choices alone. In fact, he could have had an operation that probably would have saved his life, but his health beliefs led him in a certain way. But then again, I know doctor friends of mine who, after traditional medicine failed them to treat their cancers, they went down a very holistic homeopathic route, and actually they've gone into remission from their cancers. So it's, I think the jury's still out really with these things. So the question here is about, do I believe for a cure in diabetes in our lifetime? I think it's really important to understand that with diabetes, it's there's type 1 diabetes and there's type 2 diabetes. Type 1 diabetes is a diabetes that people are born with, and that for that, there are certain treatments out there. There's treatments developed all the time. Type 2 diabetes is actually something that's closely related to lifestyle. So people can actually walk away from diabetes through good, healthy living, through eating well, through exercise, through regulating their blood sugars. So, it depends on what you mean by a cure. So there's lifestyle cures and there are pharmaceutical cures. So the question here is it true that at least 50 holistic doctors have mysteriously died in the past year alone? I'm sorry, I can't really comment on that. If it's, if they have passed away, that's a possibility. But if there's an implication that somebody is out there to try and take out holistic doctors, I mean, it certainly is something that I haven't come across myself. I think, I did answer the previous question about holistic medicine. There is certainly an increasing body of evidence that shows, holistic cures can work. However, they do need to be taken, into context. So I feel that holistic medicine shouldn't be the first option for people. Certainly, it's a very good adjunct for people suffering from, certain illnesses for them to try. And there's nothing, and as long as there's no harm that will come to that individual by going down a holistic route, I still don't think they should be taken as a preference to traditional medicine. But people who are firm believers in holistic medicine may beg to differ. Okay, so interesting question. What are my views on the NHS? Can it collapse in our lifetime? I think it's certainly a possibility. I think unfortunately, there's a strong political will out there from a section of the political class that don't believe that free access to healthcare at the point of care is free healthcare should be all right for everybody. I think in the same way that everything in life is becoming increasingly capitalized and monetized, healthcare may go down a route that the American system has, where if you get seriously unwell, it could actually end up in you becoming bankrupt. I think we have an incredible, tremendous system, and we all have to be very, consciously fight to ensure that the NHS continues as it is. So the question here is there a particular instance which happened during your career which you struggled to overcome? I think, one of the things that really does get to you, particularly when you're a junior doctor, is when you're looking after people, particularly elderly people or anybody, but on hospital wards, and you do form a very kind of close bond, a relationship, a doctor-patient relationship, but also a close friendship at times. And then when you do lose patients, it really can get to you, and you always question yourself, and you think, was there anything else that could have been done for a patient? And these things are not, it's not just a regular 9 to 5. It's, these things do kind of, you go back home and you do think about people that you've met and those people who've touched you in your life. And all decisions that you make, there's a human factor in there as well. And the question is about the future of the NHS and what could happen to people as a result of it being strained. I think we have to be very careful with the NHS. There is tremendous pressure on the NHS. That's a fact. There's also, I think, a lot of mismanagement as well within the NHS. People are, I think resources are not really being diverted in the right areas. For example, in London, we do have there is an issue with access to, healthcare, to people, to getting appointments with GPs. There needs to be a kind of a structural rethink in terms of how we're training people, which areas we need to, we have an aging population, so we need to divert resources to manage conditions that will affect the elderly. We also need to be quite, I think, in the way that people access healthcare, we have to be a bit smarter in how the NHS is funded as well. The question here is about BMI scales, so body mass index scales. Are they really that valid? What should we really follow? Should we really follow what it says? I think with body mass index, again, it's really important that there are certain ranges. So if you're, for example, above a BMI of 30, that would make you morbidly obese. But in reality, you need to look at that individual and look at their body composition. Body composition is actually much more of a useful sort of variable in terms of seeing if somebody's healthy or not. So if you look at a bodybuilder, for example, he will have a very high BMI, but he's actually generally quite healthy compared to somebody who's just overweight due to a high fat content in their body. So a body composition index would be a better way of kind of gauging someone's overall health. So the question here is about the best method to recover from a grade 2 strain of any part of the body. So again, I think you need to be a bit specific. So if you're talking about, for example, a grade 2 strain of an ankle injury, where you've done some damage to the ligaments in the joint, the general principles for managing these sorts of injuries are to rest them, to elevate them, to apply compression and apply ice, which can help reduce swelling, and also to take some anti-inflammatory medications. And people vary in how quickly they can recover from such injuries. If you're sort of a young competitive athlete, you probably will recover a bit better than an older person who lives more sedentary lifestyle. But you're looking at 4 to 6 weeks as a minimum to recover from most grade 2 type strains. But anything more than sort of 10 to 12 weeks, you probably need to be seeing a physiotherapist by that point. The question here is, do you support the technological advances being made, such as the power pill? You put it inside your body, it's alive for as long as you are, and doctors can give you a full checkup based on it. I'm not entirely, I don't really know the ins and outs of the power pill, I'm sorry. It's not something that's mainstream at the moment. There's certainly a lot of technological advances in medicine at the moment. I'm assuming this power pill is a way to remotely monitor somebody's vitals, their vital signs, maybe their body composition as well. Again, it's about people and the acceptance of using technology as part of their bodies. So, it does raise some ethical questions. So, people will hold information about you. These things can be adjusted to look at all sorts of things. So, if you're, if for example people are asking you about how much alcohol you take, and what you say and what your body says are two completely different things, then that can raise some kind of ethical dilemmas for certain people, particularly when it comes to health insurance. So I think people do need to be careful with technology when it comes to medicine. But technology will always generally promote a good way forwards for humans in the management of disease. But it needs to be a controlled technology. So the question is, if there was something you could suggest humans should do more, what would it be? I think generally there's lots of evidence out there, and I think we're all really quite aware that living a healthy lifestyle is the best thing that we can do. It's to ensure that you're eating your good selection of fresh fruit, vegetable, you're exercising regularly. You're not eating too much. You're, mentally as well, you're not putting too much strain on yourself. And most illnesses, if you look at them, they are actually as a result of lifestyle choices. So, diabetes, heart disease, hypertension, you know, strokes, all these sorts of things happen as a result of certain lifestyle choices. So we should all be very conscious about ensuring that we're living in living a healthy lifestyle. So a woman recently passed out on a train, had no idea what to do. When somebody faints, what should be the first thing you should do? So I think if you're somebody with no kind of medical training, that ideally, if you can get yourself on some sort of maybe a St. John's ambulance kind of first aid course, that'd be really good just to understand the principles of what to do. But if you're in a public place, the first thing you should do is to call for help. So if you're on a train, you press the button, you call the driver, it'll stop at the next station. If it looks like someone's just had a simple faint, it's been really hot in London recently, people need to make sure they're adequately hydrated. Just lie the person down, try and lift up their feet, because that will return blood to their heart, so that will increase their blood pressure, because that's what fainting is. It's a sudden drop in your blood pressure affecting your consciousness. So those are the simple principles. But then again, for somebody, people can collapse for whatever reason. They could have had a heart attack. It's very difficult to tell. So I think that the take-home message is call for help. Try and get the person as comfortable as possible. Okay, questions in regard to sexual relations. Is there anything more we can do to be safe besides condoms and other contraceptions? I think it's really important that obviously you are on top of using contraception. You are honest with your sexual partners. You should be. If you're going into a long-term relationship, you should both ideally have full sexual health screening. So go to a sexual health clinic, get all the tests done. Also, generally, if the less promiscuity there is, the less chance there is of contracting or transmitting sexual transmitted infections. So again, it's down to lifestyle. But if you are going to engage in sexual behaviour with multiple partners, just ensure that you're both sensible and you don't take any risks. In addition to possibilities of pregnancy, there's lots of diseases that can be transmitted. So just be sensible when it comes to these things. So have you ever had a crisis situation where you thought there was no hope, but managed to pull through in the end? I would like to use the example of a friend of mine who, she's a doctor as well, who had a very advanced lung cancer actually. It was a breast cancer that had spread to her lung, into her bones. And she was told that she had weeks to live at the time. But she was somebody, she's quite a famous motivational speaker, and she actually thought to herself that she's not going to be defeated by this, and she had a young son as well, and her positive mental attitude, her lifestyle really went down the whole living healthy, even visualizing the cancer in her body being eaten away. This was after all the kind of traditional medications didn't really help, and at the end of it, at the end of the process, 2 years down the line, she's still with us. God bless her, and she's doing quite well. I think that was an inspiration for me personally. Questions about a woman I know has been in a medically induced coma for 1 year after a car crash. Surely that's too long for someone to be in one. If she does come out, I'm assuming her way of life won't ever be the same. So, again, it's very difficult in these sorts of situations. If you do have a loved one who's been involved in a very unfortunate accident, and they are in a medically induced coma, it's difficult to say how much damage has been done to somebody's brain during this time. Obviously, the longer somebody's in a coma, the less chances there are of them making making a significant recovery. In these sorts of situations, it's really important to kind of understand what the person's wishes may have been before the injury, for example. But then again, there are cases of people who have made very good recoveries from these sorts of things. Some people have woken up after being in a coma for 8-10 years, and they're actually okay. But it's a case by case thing. You need to really speak to the medical team looking after the patients and seeing exactly what the extent of the damage might be. I mean, they can do sort of brain activity scans and to see exactly what kind of function may be left if they do come out of the coma. So a question here is about palliative care or euthanasia. It's a very, very big topic. We could talk about this for quite a long time. There's arguments for and against both of them. I think palliative care is something that's widely accepted and widely practiced, and we should all be advocates of palliative care and look after people in their dying days and ensure that they're as comfortable as possible. Euthanasia, if somebody's suffering, is it right to put them through that suffering? And if they want to end their life, then that's a choice that person, should they be entitled to make. In some countries that's a yes. In the UK it's still a no. But again, very difficult question, but it probably needs quite a long time to talk about. In regards to health insurance, when would you say is the best time to actually use one, or age? So I think in the UK we're very fortunate to have a very, on the whole, an NHS system that will look after everybody. If you get seriously unwell, I think the system can be very good in that you will get access to a specialist within the 2 week time frame. It's a national target, so anyone, for example, who's suspected of a serious illness such as a cancer can be seen by a specialist within 2 weeks. That's actually quite good. I would say medical insurance is good for somebody who may need certain specialist intervention, but the NHS waiting list may be particularly long. So, I don't think that there is a cut-off for age. I think there are employers who offer private healthcare plans. I think people should try and take them up. But then again, if you're generally healthy, I don't see a reason why you may need to take out insurance for such a thing. I know, for example, somebody who suffered from an eating disorder, and unfortunately where they lived in the UK, the local counsellors had a very, very long waiting time. It was at least a year or so before you could see a counsellor for your eating disorder. I think in that situation it's really important to have private healthcare insurance where you can see somebody a bit quicker if you need to. Funniest moment in your profession? There's been quite a lot of funny moments actually. Certainly, working in urgent care in A&E, you do see some interesting people turn up at odd hours of the nights and the day. Normally, after having sort of put things in certain places, shall I say. I probably shouldn't elaborate much more on a live web chat, but I'm happy to give you my stories over a dinner sometime, if you can keep your dinner down, that is. What should you do when you think you have symptoms of depression? How severe is depression? So, again, very good question. Depression is actually the commonest symptom that GPs see on a day-to-day basis. It's more common than a cough or a sore throat. There's a lot of unhappiness out there. I think if you do recognize symptoms of depression, if you feel, everybody feels down sometimes. It's just part of life. Things happen in life that make you feel down. However, the issue is that if these symptoms persist for any prolonged period of time, so if you're, in general practice land, if you're feeling low for more than about 2 weeks or so, you really should be starting to think about, do I need to see my doctor? Ideally, first you should maybe just have a chat to your close friends. So if evidence shows that having a good social support network is a very good way of combating depression. But if you're having problems with your sleep, if you're having problems with concentration, if you've lost your appetite, if it's affected your general drive in life, and you really feel that it's affecting your ability to function, then you're at a point where you really should be speaking at least to your doctor about it, because there are lots of really good treatments out there. I think mental health, luckily, fortunately, due to concerted efforts by pressure groups, patients, and the media, it's not the kind of taboo subject that it used to be before. So you can quite easily go and see your doctor and and see a psychiatrist or a psychologist without really being labelled anything these days anymore. So please do, if you have any of these sorts of symptoms, do see your doctor about it. If it's left untreated, it can be fatal. People take their own lives. It's very sad. I know doctor colleagues of mine that suffered from depression who unfortunately took their own lives because they ignored their own symptoms. So it is really important that you take mental health as seriously. I mean, I think people focus on their physical health, but they neglect that actually your mental health it's all related. We have our system is one unit, so your mental health relates to your physical health. So you can't really be physically healthy and being mentally unhealthy, if you see what I mean. So again, just following on from that, good question here. Mental health is a taboo in many communities, especially black communities. What steps can we take to get the topic out more? I just think that we all need to reduce the stigma. We need to talk about it. We need to use forums like Spiela to get it out there. So if you're feeling low, you need to talk about it. You need to let people know how you feel. Obviously, you don't need to broadcast it to the world, but speak to your friends. And these mental health services are actually quite well funded now. And nobody should be suffering in silence. It's not right, and the services and the access to services should be there. There's very good access. People now can refer themselves actually for basic services. So wherever you live in the UK, you should have access to something called IAPT, improved access to psychological therapies. So if you just Google that in your area, people can self-refer. Before they might have been a bit uncomfortable with going to see their own doctor to talk about their mental illness, but now you can have access to these services quite easily. Question here is: I do running regularly and I feel my knee is about to give way. I get the occasional sensation, but it doesn't give way. Any advice? So you may have a ligamental problem with your knee. If you're a young person, generally you shouldn't really have any serious degenerative problem with the knee. It probably needs strengthening. So although you're running quite regularly, you may need strengthening of the joint around the knee. So specific exercises around your quads and your hamstrings to help strengthen the knee joint itself. So I would see your doctor if you could do that. Failing that, then see a physiotherapist, and I'm sure they'll be able to give you the right advice for that. But I can't really comment further without examining you. Okay, I heard a story a while back of a few guys who got cancer near enough at the same time. They blame it on industrial area they went to school near, which I'm assuming pumped deadly gases. What are the common gases which can cause cancer? So, there's a whole host of environmental chemicals out there that can cause it. There's lots of evidence of people who live and work near power plants, be they nuclear, coal, gas, or other. These things are not healthy. Even now, where they're kind of undertaking fracking in certain areas, they're saying they'll compensate these communities, but actually, there are healthcare risks associated with being exposed to any of these sorts of chemicals. So, we know that radioactive gases, argon, other materials such as mercury, all these things can have very drastic consequences. Lead, if they enter the food chain of a local community, can lead to malformations and health problems. I mean, traditionally, people who work with asbestos developed a certain type of lung condition, which was unique to those people working with that particular chemical. So yeah, I mean, again, there's lots of different chemicals will cause these things. Do you think the pills they give to deal with depression are that good? Talking about it and opening up surely is more of a cure. Yeah, so I think it's important to understand what depression is. And depression or other mental health problems such as bipolar affective disorder, schizophrenia. Sometimes with depression, you can have a very real imbalance of the levels of neurotransmitters in your brain. So serotonin is the main chemical in the brain that helps you to feel better about yourself. So certain medications will help reduce how quickly serotonin is broken down in the brain, and that will make you feel better. But absolutely, you can't just, if you're feeling low, if you've had difficulty in life, in personal relationships, you can't just take a tablet and it's going to make it all better. I think people, we live in a day and age where people want this kind of immediate result. You've got a problem with something, you want to take a pill and it's going to make you better. That's not going to happen. It's going to help. It's part of making you get better, but you do need to address the other issues. So you do need to talk to a counsellor or to friends, or receive some, CBT, cognitive behavioural therapy. But do see your doctor and speak to them about this specifically. Some people, but some people really do need these medications to make them feel better. If they've got very severe, intractable depression, they will need certain medications to help them have that initial recovery, I believe. Okay, so saddest medical story you heard about this year that you can shed light on. I'm just trying to think at the moment. I'll try and get back to you on that one. I mean, there's been quite a few sad stories I've come across. But yeah, I'll get back. Do I support the vegan movement? I'm not a vegan myself. I think people can live quite a healthy lifestyle being vegans, but it's very important to understand that you need a certain amount of amino acids in your system that are very readily available in meats. You can get them through purely taking vegetables. However, you have to be very careful and you have to be educated in terms of what you're taking. So if you're missing a certain amino acids, it will have an effect on you. It will have an effect on your general mood, your happiness, your overall drive. So provided you understand that living a vegan life does come with a responsibility to know what needs to be taken to make you physically fit and healthy. I think there's no reason why you can't be healthy and be a vegan. What would you say to a young doctor trying to make it out as a doctor? What would you say to motivate young people? So I think it's whatever your dreams are, whatever your career aspirations are, follow your dreams, work hard. Nothing comes easy in life. I went to the opening event to Spiela the other day, and it was really, it was a pleasure and a privilege to be able to sit down with everybody else and listen to people's stories. The three panelists who are successful people. Follow your dreams, but you need to put in the hard work. Medicine, it's not I have to say it's not for everybody. It can be a very challenging career, personally, professionally, physically. Being a junior doctor, being a doctor, doing night shifts, long shifts, weekends, the emotional toll it takes on you and your family and the personal relationships that you have. It's something that, but I think for me personally, it's been worth it. It's helped me grow as a person, and it's helped me to help people, and that's something that you can't put a price on. Okay, so thank you everybody. I hope that was useful. Please do feel free to drop me a direct email or send me a Facebook message on Facebook. My name is Ali Razzak, or through the chat through the Facebook space on Spiela. Thank you, everybody.